rousing ovation, can we welcome Dr. Enow speaking to us? I think we can do better. You have the floor.
Thank you very much for that presentation.
Yes, we can hear you.
I can see faces. Thank you very much. Okay, great. Hello. Can you hear me? This is what we want to see for this generation. Populations in the world. It is by young innovators like this. Me and you have the responsibility to shape the healthcare system in Africa. And the question is no longer whether digital technologies will transform healthcare. The question is, how do we ensure that digital transformations benefit everyone? How do we ensure that digital health protects the rights, but also strengthens, different healthcare systems that are already fragmented? And the reality is, the answer lies in a good digital health governance. And at the labs, we try to understand, why does digital health matters in Africa? Why do we focus on digital health in Africa? Africa faces significant health challenges. As medical students, as healthcare professionals, you would agree with me that there is a shortage of healthcare workers in Africa. Most of you might have dreams of going out of Nigeria to go and specialize, or to go for residency, or to go and work for greener pastures. And so there is a shortage of healthcare providers in Africa. There is limited access to specialist care. For example, you are somewhere in Ecom and you want to get a gynecologist. You might need to go a far away distance to get a gynecologist. There are weak health information systems. We have inequity between the rural and the urban communities. There's a rising burden in communicable and non-communicable diseases, but we do have the opportunity of digital health. Today we have telemedicine. Today, as a doctor, I can sit and consult a client online through telemedicine. Today we have AI, artificial intelligence. We have electronic medical records. We have digital disease surveillance. We have the Ebola pandemic outbreak in DRC. And Africa CDC developed a digital disease surveillance, to be able to curb the spread of Ebola in DRC. We have mobile health applications, remote diagnostics, wearable technologies, and you can name them. But these technologies are helping countries to improve access, efficiency, and the quality of care. Today you can see me, you can hear me because of technology. But however, technology alone does not solve health problems. It does not. Of course, that's why you go to medical school, to learn, to get skills. So without proper governance, technology can actually widen inequalities. That's why the governance of digital health is very important. And you would ask me, what is digital health governance? It really means that the policies, the laws, the institutions, the standards, but also accountability mechanisms that can guide digital technologies, which are designed, implemented, but also regulated. That's why government is very important when we talk about policies, when we talk about laws or institutions. And if you want to put it in a very simple manner, governance ensures that digital health serves people. It serves everyone. It serves humans, not the other way around. We don't serve governance. Governance serves us as people. And so therefore, good governance will answer questions such as, who owns our health data? If I go to the hospital and I'm sick and I provide my data, who owns the data? Is it me who owns the data, or is the system, or is the government who owns health data? Who can access digital systems, and how can we communicate them? How do we also regulate AI in healthcare? Because we know that AI is very important, but again, AI can also be at our disadvantage. How do we regulate AI in healthcare? Currently in the UK, social media has been banned, for young people under the age of 16. And many countries are beginning to limit the access of AI for young people. How do we regulate AI in healthcare as young healthcare professionals? How do we ensure that innovations are equitable? We saw that during COVID-19 pandemic, where countries in the global north had more efficient medications and vaccines than countries in the global south. How do we make sure there is equitability when we talk about innovation? How do governments and innovators work together? There is that bridge that we need to come together as governments, as innovators, to work together to be able to answer these questions around digital governance. So there is good news. There is good news, dear young medical professionals. The good news is that we are making significant progress. I must tell you that at the level of the African Union, the level of the Africa CDC, significant progress has been made. As I speak to you now, many countries in Africa, we have digital ID systems, and many countries in Africa are beginning, to evolve when it comes to making progress around the digital landscape. And recently, Africa CDC developed the digital transformation strategy for Africa. And within African Union, they continue to promote digital transformation as part of a broader development agenda. So it's really an important facet within African Union work or strategy. Also, WHO has developed a global strategy on digital health, which encourages countries to build, people-centered digital ecosystems. The most important thing is that whatever innovation that is built must be person-centered, not the other way around. It is, on nursing, whatever part of healthcare you're studying, you'd agree with me that digital health is not yet a component of your study. So tomorrow now, as a doctor, you want to consult. How do you manipulate digital technology to be able to provide high-tech, solutions to your patients without an understanding of digital health? It means that we need to bridge the gap around digital literacy. Now, there are really 5 pillars I want to talk to you today about the strong governance. 5 pillars, which I think it's very important as we continue with this conference. One is that digital health governance has to be people-centered. Once designing digital health technology, it must be centered on people. They must begin with people's needs. What are the needs of the people? So in that case, the real ones are the ones that solve these real problems. Because when you're designing an innovation, you want to ask yourself, who will this innovation benefit? Who might be excluded? Is it usable? Is it affordable? Is it culturally appropriate? All these questions are very important when designing a strong digital health solution. So it must be people-centered so that it reduces inequities. Also, there must be data governance. We recently noted when Trump and the Trump government, withdrew funding through US aid. We noticed that in Africa, and so with the withdrawal of US aid, data of many governments was vulnerable. Cameroon was not left outside. Cameroon too was part of it. And so health data is among the most sensitive information we process. And as healthcare providers, you know how important the data of an individual is. And so for us to have a strong governance, we must ensure privacy. We must ensure confidentiality. We must be informed consent. It must be ethical. We must look at cybersecurity and also the responsible use of data. There is no data governance without trust. It's impossible. Because without trust, no patient will share their information. As a doctor, I have noticed in my practice that patients always lie. At first, every client that comes to you would first of all tell you a lie. When you create an environment of trust, then they will begin to tell you the truth as a doctor. Because at first there is no trust. But when you build trust with your client, then they'll give you the right data. And so trust is the foundation of every digital health system. Without trust, patients will never share their information. Without data, digital health cannot function. Data is like the engine that fuels digital health. The next pillar is around ethical artificial intelligence. Today, all of us are using different forms of AI. Is it a poster? Is it consulting? I'm sure even you, when you want to study, you use AI. When you want to write exams, you use AI. When you want to develop a paper, you use AI. AI has a lot of benefits. AI can assist even in diagnostics. I wonder how many doctors now go to AI to help how to diagnose a disease. AI helps in prediction, in medical imaging. Today, you can do an ultrasound in Ibadan. You don't need to be there in person. You can work in London, and then the machine is in Cameroon, and you receive and interpret the images you get. You can make a good clinical decision through AI. We use AI even for public health surveillance. But all of these benefits of AI also comes with a lot of risk. A lot of risk. Because AI will exclude certain populations. You see, and it's important that we also use AI responsibly because we have to make sure that whenever we use AI, it is transparent, it is fair, we are accountable even for the AI we are using. And so, for us to be able to use AI perfectly, it must be regulated. And I would really look forward to hearing your thoughts. I hope you have questions and reflections after this keynote. Better understand how can AI help you as a healthcare professional in your work. I know most of you are passionate about digital health, working around the field of digital health as healthcare providers. Remember that I can be good as well as can be bad. The next pillar is really around sustainable digital health ecosystem. For us to have a good healthcare governance, the ecosystem of digital health needs to be sustainable. And for sustainability, we're talking about government ownership, not on your own project. So the government ownership of its digital Also, you have skilled workforce, skilled workforce, supportive regulations, partnerships between academia, industry, government, and communities. All of these form a good digital health ecosystem. But what is your role as an undergraduate researcher, someone passionate about research? What is your role? There is really a lot you can do as a young healthcare researcher. One, you want to find out what solution can I provide within the digital ecosystem? Have I involved different users in my design? Is there patient privacy in the innovation I want to develop? Because as you develop new solutions, you also want to make sure that it is inclusive, it's affordable, it can be scaled nationally, there is privacy, and all of the other things that contributes to a good digital health ecosystem. Technology cannot be governed and cannot be sustainably scaled if young people are not involved. And so therefore, my call for action to you, young healthcare professionals, is that Africa needs you. Africa needs you. I know most of you, when you leave medical school, you want to look for greener pastures. You want to go for scholarships. You want to go work in other places. But I must let you know, Africa needs you. You are the backbone in Africa. And Africa needs more than digital health applications. Africa needs better governed digital health systems. We need innovators who understand both technology and health systems. And I hope that some of you tomorrow would go to do even master's programs in digital health. We need researchers that value ethics as much as innovation. We need leaders who see governance not as bureaucracy, but as an enabler of trust, of equity, and sustainable impact. And as you undergraduate researchers, you are not just preparing for the future, you are shaping the future of healthcare across the continent. You are what we need today. I love the fact that there is already a passion on digital health. Therefore, as DTH Lab, we stand by you. We are here to support you in the best possible means we can, so you can develop these ideas, these innovations that will shape the Africa we want. And so, my dear healthcare professionals, when we talk about digital transformation, we don't only talk about technology. We want to improve the lives of people. We want governance that ensures transformation in equitable access, in trust, and in sustainability. Today, I'm talking to you about digital health, but tomorrow the story might be different. And so therefore, as we look into transforming healthcare in Africa using technology, I want to encourage you that the opportunity is vast. The terrain is vast. We are still evolving as far as digital health is concerned in Africa. There is so much you can do. So therefore, it is time for you to look into what really gives you, what is your interest around digital health governance, and how can you become a strong innovator to building good healthcare systems that are resilient, that are equitable for all, and even for generations to come. And just to end to say that yesterday I was looking at my son and I was asking myself, what kind of healthcare system do I want to build for my son that's 3 days old? Do I want a healthcare system that is fragmented, or do I want a healthcare system that will guarantee his health in the future? I ask you that same question. What kind of healthcare system do we want to build for Africa? Let us invest in digital health. Let us invest in building technology that answers to the people's needs as it is today. And I am sure that my colleague Rachel will talk to you tomorrow during the workshop. You will have a lot to learn about what we do at the labs. But I want to end by saying that we are very much, happy with the work you do, and we are here to support you in making sure that the dream you have in digital health comes to reality. Thank you very much for the opportunity. Thank you for your kind attention, and definitely I'm open for us to have a conversation around data governance and digital health. Thank you very much, and over to you.
Thank you so much, Mr. Enow. Thank you so much, Mr. Enow Georges Stevens, for that very passionate presentation on digital health governance. I personally learned that technology does not equate innovation, and that if we're not careful, technology would actually expand the inequities that are already present in healthcare. Please, another round of applause for our presenter. I would now ask if anyone has any questions for Mr. George Stevens. You could step out to ask your questions with regards to digital health, question with regards to health governance. Please do step out to ask your questions. So when you ask your questions, your name and then your school and then your question. Name, school, question.
All right. Thank you very much. Doctor, my name is Adeyemi Oluwadunsin. I'm a master's student, medical sociology from the University of Ibadan. My question is on digital health technology, and I want to ask a question about equity, because as a sociologist, I am also interested in digital health, bridging the gap between medicine and the society. So my question goes thus. Digital transformation promises scale. Well, I know transformation could be positive or negative, but I want to come from the perspective of equity. Now, I am interested in public health students that are here. I'm interested in tobacco cessation in relation to the cardiovascular, cerebrovascular diseases. So my question is, how does governance strategy account for the digital divide? For example, in smoking cessation campaign, cessation tools are hosted on smartphone or require consistent internet. Are we risking a transformation that actually widens health inequality? Because we all know that there are still some parts of the world that even are being marginalized. So I want to ask that particular question. I don't know if you are able to grab that. Thank you.
Thank you very much for that wonderful presentation. My name is Oninechi Osisiogun. I'm a medical student here at the University of Ibadan. My question is more focused to the bias that's inherent in data. We know that most of the innovations that have occurred, especially in the realm of artificial intelligence in healthcare, has come from the global West. And that data does not always necessarily reflect what is going on in this part of the world. And often it is said that the data contains inherent biases due to systemic inequalities that marginalized communities in those countries have experienced. So my question is, what role does digital health governance play in mitigating systemic bias such as that's contained in data, and that data that's then being used to train and inform further developments? And aside that, is also related to that question, how does digital governance, how does it account for societies in this part of the world that can't necessarily access innovation? Is there any role it plays in bridging that gap? Thank you.
Thank you, Mr. Dr. Enow, for the discussion earlier. So my question goes, I have three questions first of all. So the first one goes a bit along with the line of the first question that was asked about equity. So it's really about can Africa digital health become independent? Can we toe the path of independent, or do we need to, for maybe the next 5-10 years, depend on being piggybacked by Western AI ecosystems? And the second one is really straightforward. Who funds Africa Digital Health as it stands now? So looking forward, I believe maybe DTH must have worked on something bigger to see as, okay, standing in this current day and maybe looking in the nearest future, can African nations come to pay the full cost of setting a digital health ecosystem? And what's this cost if we are really to maybe point into it? And then looking in the future, will it be profitable to the nations, right? And then lastly, for us young people, how can we build collaborations to bring to life ideas we have, especially in the healthcare sector, using digital health solutions? Thank you.
Questions, so you can answer them now.
Yes, thank you. Thank you very much for those questions. I think I love the questions you've asked. And I want to start from the last person. I'm sorry I didn't get your name, but I want to start from your 3 questions. You've asked a very important question. You know, can Africa data become independent? The reality is the person who funds you controls your data. And I love that you've asked that question because recently, 3 months ago, when Addis trying to discuss around the digital health architecture for Africa and how Africa can become independent in managing its data. Now, let me be honest with you. Wellcome Trust funded that work. And Wellcome Trust is a UK-based organization. Now, the reality is the person who funds you almost always has authority or some power over your data. We saw this with the US government. And if you're very keen to listen to the news, you'll see that Zambia refused funding from the US government because they wanted to access sensitive health data. But unfortunately, Zambia was one of those countries that refused. Most other countries accepted. Cameroon accepted. Mozambique accepted. It means that who funds your work always sometimes have more power or control over your data. So what's the solution? The solution is governments have to own and develop their digital ecosystem and infrastructure. When we depend on external funding or external support, they tend to drive and manage the data. That's the problem we have in Africa. It is because most of the funding comes externally, and that funding comes with conditions, with specificities around data, around how data can be managed. You'll be shocked to hear that in Cameroon for the past 6 years, the US government was managing data on HIV patients through USAID. And so all this data was recorded in private electronic medical record managed by USAID until recently that it was officially given to the Ministry of Public Health. So there is a problem around ownership. Ownership only comes when you have economic and financial power. And that's why I have really stressed on the fact that there is need for government ownership, sensitive. And we cannot accept or allow external donors and funding to influence or use our data. So that's the problem. Now, who funds Africa Digital Health work? Now, there are different donors. That's the second question you asked. There are different donors and governments that fund the work. Africa CDC developed an Africa continental strategy around digital health. And this funding came from member states by the African Union, you know. But at country level, governments have developed their digital strategies. And so it depends on the focus of the strategy, and that is where the funding will come from. But specifically for Africa CDC, the funding came from African Union through African government. As you know, governments fund African Union. And so, and from that funding, there's a docket on digital health. You see. Now, the question you asked was around how young people can join the network, you know, for healthcare innovation. So I have 3 things to mention. I think someone's mic is on. I can still hear myself. Okay, fine. I think that's fine now. So how can young healthcare professionals, you know, engage within digital health, I would suggest or I would advise that at Africa CDC, we have developed a youth in digital health network. If you are very interested and passionate about digital health, I'll create your indulgence to join this network. It is called the Youth in Digital Health Network by Africa CDC. You can write me through my email, and I'll send you the link on how to become a member of the network, because we fund young innovators. We provide funding to young innovators who have different innovations around digital health. So it is called the Youth, the Youth in Digital Health Network of Africa CDC. Now, from the DTH Lab, we also have what we call the My Health Futures Youth Network. It's a network where we also share opportunities to young people and develop joint proposals together. It's called the My Health Futures Youth Network. We have a network on LinkedIn. You can also join that network to become engaged around digital health. But just to tell you that the Youth in Digital Health Network is really practical. Like, it's really practical. We have monthly sessions, we share opportunities together, we develop joint proposals, we have publications, we write articles through this network. So it's a very important network you might want to also join. Now, I want to go to the question which Onyenechi asked around the digital health architecture and AI. So, as I said, now, Africa really is still very young. Africa is one of the youngest continents in the world. And so there's a lot of innovation that happens within the continent. Now, recently we developed an architecture, a framework, a regional framework for digital health in Africa to be able to manage our things by ourselves. It was driven by AMREF Health Africa, and that was still funded by Wellcome Trust. Last year, we did that in Kigali, Rwanda, where we brought together different health innovators to develop a regional framework on digital health for Africa, led by AMREF Health Africa. And so there is some progress that has been made in terms of developing an architecture for Africa, because we tend to receive digital innovations from the global north. You see, we tend to receive digital innovations from Europe. But the question is, does this really answer to the needs of people in Africa? Because our challenges are different. Our needs are different. The health needs of someone in Belgium will be different from the health need of someone in Nigeria. And so when developing technologies, they must be centered around that particular region. So it means that even when we're developing the strategy, it must answer to the needs of our continent and region. There are differences. And that's why we're looking at this framework, this regional framework or architecture that can govern digital health. So I do agree with you that we must not always accept innovations that are not person-centered for Africa. That's why we are really pushing forward to developing an architecture that responds to the needs and challenges of Africa. Now, I would end by answering the question of Adeyemi. Adeyemi asked a very interesting question around governance and how do we try to, there is wide inequality, how do we reduce that inequality? Now, I would really ask you, Adeyemi, I think we are doing some good work around digital determinants of health. And I'm really interested in the work you're doing on sociology. And I think it would be important for you to consider joining our community of practice around digital determinants of health. We really look at the different issues that govern digital health. And so I think that it would be very important for you, the digital determinants of health community of practice, if it's of interest to you, because within that community of practice, we look at how we can remove this widening gap in inequity for governance of digital health. And so I think it will be important for you, and I'm happy to share with you the links on how you can join the community of practice for digital determinants of health. Also to mention that we're currently developing a policy brief together with Africa CDC on digital determinants of health in Africa. We'll be launching that policy brief in September at the Africa Health Tech Summit in Kigali, Rwanda. And we're currently concluding the policy brief on digital determinants of health in Africa. I think it'll also be of interest to you. So you can always reach out and I can link you up if that's of interest to you, especially as you're looking at the different aspects within governance of digital health. So I think I've been able to answer your questions, and still happy to take any questions if time permits.
Yes, we lost you at a point in time, but now we can hear you.
Okay. So I think that's it. I'm not sure if there are other questions.
Session, another round of applause for him. It has been such an engaging and an enlightening session, and we are also extending our thanks to Digital Transformation for Health Lab for being platinum sponsors for this conference. Thank you very much once again. So moving on, we're going to be hearing from the president of CRIH. Then one of our speakers is already around. That's Dr. David Adetula. He's already seated here. So please, a round of applause for him. We're going to be listening to him next, and he's going to be taking the writing effective policies as a student researcher. But before we have the president of CRIH give his opening plenary, I just want us to do a very tiny exercise. Everybody please stand up. Please stand up. It's just to stretch your body. Just exercise. Please, could you just play any music? Just any music. So I need 2 volunteers. I speak very well, but apparently when the Heavenly Father was distributing gifts, dancing was not one of the things that he gave to me. So I just need to actually lead us in this sort of exercise thing.
Hey, I hope you got on your exercising shoes, because today...
So anybody, I'll just... No, sorry. Please wait. Let's get our volunteers first. A volunteer from the audience. Fine. There's somebody wearing. Okay. Are you volunteering him to come out? Yeah. Please just come out. Thank you very much. Thank you very much. We are waiting for you. Thank you. So it's going to be a do as I do kind of thing. You don't have to be shy. You don't have to be shy. It's going to be a do as I do kind of thing. So yes, you can start the music now.